So in today's video, we're diving into something that sounds kind of rare, but it's actually more common than you might think. Yep, we're talking about tapeworm infections. And more specifically, we're going to walk through the symptoms people experience when they have one of these little guys living inside them. Now I know it sounds like something straight out of a horror movie, like a worm living in your intestines. Yeah, not fun. But if you've ever had unexplained stomach issues, weird skin symptoms, or even felt extra tired for no reason, you'll want to stick around because we're going to connect the dots and break it all down for you. So here's what we'll cover. First, what exactly a tapeworm is and how people get infected. Then we'll move into the signs and symptoms, both the common ones and the weird, unexpected ones. We'll also talk about how doctors diagnose it, what treatment looks like, and finally, I'll give some helpful exam tips at the end, especially for those of you studying medicine or nursing. Sound good? All right, let's get into it. So first things first, what is a tapeworm? Tapeworms are a type of parasite. More specifically, they're flatworms that can live in the intestines of humans and animals. Now here's where it gets interesting. There are different species of tapeworms, and each one can infect us in a different way. The most common way people get infected? Eating undercooked or raw meat or fish that has tapeworm larvae inside. So sushi, rare steak, or poorly cooked pork, those can all be potential sources. For example, Taenia saginata comes from beef, Taenia solium comes from pork, and Diphyllobothrium latum, that one's from raw or undercooked fish. There's even one Hymenelepis nana that can be passed from person to person without any meat at all. And Dipylidium caninum, that one comes from accidentally swallowing fleas from your pets. Yeah, gross, I know. In fact, a 2025 WHO review on neglected parasitic infections emphasized that zoonotic tapeworms, especially those that come from dogs, pigs, and contaminated water sources, remain a significant public health concern in low-income regions. So this isn't just a rural or developing world issue. With global travel, migration, and changing food habits, cases have been reported even in urban settings in high-income countries. All right, so let's say someone gets infected. What happens next? What are the actual symptoms? Let's start with the common signs first. One of the most classic symptoms is the passage of proglottids. These are little white segments of the tapeworm that actually break off and come out in your poop. Sometimes people even find them in their underwear or on bed sheets. Yeah, that's definitely a call your doctor right now moment. Another common symptom is anal itching, or what's called anal pruritus. It's caused by those moving worm segments irritating the area around the anus. And then there's abdominal pain, often crampy and kind of vague. Sometimes it's worse in the morning and improves a bit after eating. Some people also report nausea, loss of appetite, or even the opposite, increased appetite, especially with Taenia species. Oh, and let's not forget fatigue or general weakness. That happens because the tapeworm is literally stealing nutrients from your food before your body gets a chance to absorb them. Now, before we go further, if you're finding this video helpful so far, don't forget to hit that like button and subscribe to the channel. It really helps us grow and keeps these lessons coming your way. And hey, if you've got any questions or thoughts while you're watching, drop them in the comments. I love hearing from you. All right, now let's move into the weird stuff, the less obvious symptoms that sometimes get overlooked. So one really important one is vitamin B12 deficiency. This especially happens with Diphyllobothrium latum, the fish tapeworm. What makes it so sneaky is that the worm absorbs your B12 in the small intestine, leaving you depleted. And what does B12 deficiency cause? Well, a whole range of neurological symptoms. You might get tingling in your hands or feet, what we call paresthesia, or you might notice you're forgetful, or it's harder to focus or think clearly, almost like brain fog. Some people even develop mood changes like depression or irritability. In more severe cases, B12 deficiency can lead to a shuffling gait, where someone walks slowly, almost dragging their feet, similar to Parkinson's. It can also cause macrocytic anemia, which means your red blood cells are too big and not functioning properly. That leads to fatigue, pale skin, and shortness of breath. A 2024 clinical update in the American Journal of Tropical Medicine even noted that in elderly patients, this B12 deficiency is sometimes misdiagnosed as early cognitive decline or dementia, so it's super important to test for it if there's a history of raw fish consumption. Another weird symptom? Itchy skin rashes. Especially with Hymenelepis nana or Dipylidium caninum, the body can mount an allergic response leading to red, itchy patches, often on the arms or trunk. Some people even get subcutaneous nodules, which are small lumps under the skin. These are more common in Taenia solium infections and are actually little cysts called cystic ursi. formed when the larvae travel outside the gut and into your tissues. Speaking of that, Taenia can cause a more serious condition called cystic urcosis, where the larvae invade tissues outside the intestine. If they end up in the brain, it's called neurocystic urcosis, and that can lead to seizures, headaches, even stroke-like symptoms. In fact, in some parts of the world, it's one of the leading causes of acquired epilepsy. The CDC's 2025 guidance actually places neurocystic urcosis as a key differential for new-onset seizures in immigrants or travelers from endemic countries. So, if you're practicing medicine in a multicultural city, you need to have this on your radar. There's also something called obstructive cystic urcosis. That's when the cysts block certain ducts in your body. For example, if they block the appendix, it can cause appendicitis. If they block the cystic duct, it can lead to cholecystitis or an inflamed gallbladder. And if they block the pancreatic duct, it can trigger pancreatitis, which, by the way, can cause severe pain in the upper belly that radiates to the back and gets worse after eating. So yeah, not your everyday worm problem. All right, how do doctors actually diagnose a tapeworm infection? Well, the most common way is a stool test. They'll check your poop under a microscope to look for tapeworm eggs or segments. Sometimes they need a few samples on different days because eggs aren't always shed consistently. In cases where there are symptoms outside the gut, like seizures or nodules, they might do a CT scan or MRI, especially if they suspect neurocystic urcosis. Blood tests can sometimes show eosinophilia, which is a type of white blood cell that goes up in parasitic infections. Interestingly, newer PCR-based stool tests have started showing promise in 2025 for species-specific diagnosis, which helps guide more accurate treatment, especially in co-infected individuals. All right, now on to treatment. The good news here is that most tapeworm infections are very treatable. The standard treatment is a single dose of an anti-parasitic medication, usually praziquantel or albendazole, depending on the species. It works by essentially paralyzing the worm so your body can get rid of it. In cases of cystic urcosis, treatment might be longer, and doctors may add steroids to reduce inflammation, especially if the brain is involved. Now, when it comes to prevention, the biggest thing is proper food hygiene. That means cooking meat to safe temperatures, freezing fish before eating it raw, washing hands, especially after handling pets, and regular deworming of pets to avoid flea-based tapeworms. All right, let's wrap things up with some exam tips and mnemonics, especially for my med and nursing students watching. Here's one for remembering the complications of cystic urcosis. Just remember the word SPACE. S for seizures, P for pancreatitis, A for appendicitis, C for cholecystitis, E for eosinophilia. Another tip, when you hear fish tapeworm, immediately think B12 deficiency. And remember, neurological signs with anemia? That's your clue. Also, a little anatomy tip. If pain radiates to the shoulder blade, think gallbladder. If it radiates to the back and worsens after food, think pancreas. And finally, if you hear the words seizures in a person from a developing country, your differential should scream neurocystic urcosis. So yeah, tapeworms may sound like a rare problem, but they can cause a whole range of symptoms, from mild to downright dangerous. And the better we understand those signs, the faster we can diagnose and treat them. If you found this video helpful, don't forget to like and subscribe, and feel free to leave a comment below if you've got questions or want to suggest another topic. Thanks so much for watching, and I'll see you in the next lesson. Take care!